Hi, I'm Kathy Toronto with AesthetiCare, and I'm so excited to be here with you today. I'm going to do a treatment called Halo. I've got my good friend Hope here with me today. She's had a Halo treatment before, but she's really good at coming in on a yearly basis to have this treatment. It's one of those treatments that you just get instant gratification, which is why it's one of our most popular treatments at AesthetiCare, because you see what's happening in your skin over a week, 30 days, 60 days, and 90 days. So I'm going to get started with her. She's had topical numbing cream on for about an hour. I've cleansed that off. And now I'm going to use a product called Laser Sun Spray. And Laser Sun Spray is something that we use during many procedures here at AesthetiCare. It's a product that came out in the past year, and the ingredient is called hypochlorous acid. And what it does is it helps to, it's actually an anti-inflammatory, antibacterial, antifungal, antimicrobial. So it really helps to prevent any type of infection. And I love it for this also because it's not so harsh on the skin. You know, prior to using hypochlorous acid, we used alcohol, which just, smells really bad. It's really drying. But this product is something that you can use prior to the treatment as well as post-treatment to really help with inflammation and preventing any type of infection in the skin. So I love this product. So I'm going to go ahead and prep the skin with the hypochlorous acid or the Laser Sun Spray and get set up within the Halo treatment. So Hope has her eye shields on, and sometimes those little stickers tend to want to pop off. So I'm going to go ahead and put on some external eye shields as well. So have you lift your head up for me. Perfect. Just tighten them up for you. Is that okay? If they're pinchy at all, let me know. Okay. All right, so within this treatment, one of the things I love about it is the technology itself is really smart. So, you think of our cell phones, or that first cell phone that you had back in the day, it could text, sort of. I mean, you had to push 1 like 3 times to get to C, but you could send a text. And now our cell phones are just so advanced, and the same things happened with technology. I've been doing fractional laser technology for over 10 years, and as it's just come so far. It does so much for you now that it gives us the ability to really customize a treatment, do great things over different or in different areas of the skin, different concerns in the skin, but it's very safe. So that's also one of the things I love about it. So the first part of the treatment is just measuring the area to be treated. So you'll see right here, this is the Halo handpiece, and I'm going to start on her cheek and measure her cheek area. So I'm going to be right down on your chin. And she doesn't feel anything right now, just pressure from the handpiece, because again, it's not firing. It's just taking the measurements for me. And then from your nose to your ear. And I'll press save. It'll mimic it to the other cheek, so I don't have to measure the other cheek. And then up on the forehead, so I'll be right in between your eyebrows, moving towards your hairline. And then opposite direction. And save. Again, it mimics it to the other side, and I'll jump to the nose. So the nose, I'm just going to start right at the tip of your nose. And I'm going to do that one more time. And then opposite direction. This can feel a little funny because it kind of pushes against your nose. And save. So the first step of the treatment's done. The second step of the treatment, and actually with Hope, I'm going to measure one more area. So one of the other things that is really nice about this treatment is it gives you ways to customize the treatment. And so for her, one of her concerns is pore size and then scarring from previous acne breakout. And so I'm going to do a little bit more in this area of her cheek for just to help reduce pore size, and then also to treat any acne scarring that she's had over the past 5 to 10 years. So I'll measure that zone as well, and I'll probably break it down between just this one zone here and really down here. So I'll measure here first. And then I'll have that zone measured, and I'll be able to use that measurement for other areas. I'm just going to double check all my zones. That looks great. And so the next part of the treatment is choosing my settings. And so again, I'm going to choose settings for Hope that will help to improve pore size, acne scarring, but also just overall skin rejuvenation. So as we age, we start to see more laxity in the skin. A lot of our clients present with pigmentation in their skin. She has beautiful skin. She doesn't have any sunspots or hyperpigmentation. She's had treatments in the past. She's really good at wearing sunscreen. So I don't see much of that. If she had more pigment or had some pigment, I would adjust my settings here. But in this case, I want it to go deep. I want it to go into the dermis to force that thermal injury-like reaction in the skin that wakes up the skin and says, hey, produce collagen elastin. So I'm going to choose a deeper setting because of the conditions she presents with and the results she would like to see. And I'm going to turn on a device that blows really cold air, so she'll be able to blow some cold air on her skin while I do the treatment. Okay. You ready? So I'm going to start on your right side, down along the jawline, just over on your chin. So with Halo delivers two different lasers or two different types of energy to the skin at the same time, which results in two different types of wounds. So one is a wavelength that gets absorbed by water really superficially in the skin, just a little bit past the dead skin cell layer, and it heats up water to 100 degrees Celsius, causing vaporization and ablation. So it literally is ablating or removing some of the tissue, just like when you heat up water on the stove. It starts to boil at 100 degrees Celsius, and then it turns into steam and is out of the pan. So with this, you get a really kind of light, superficial peel that happens from that laser. The second laser wavelength gets absorbed much deeper in the skin, and it gets absorbed in the area where we see most of the damage. And what it's doing is creating that kind of wake-up call for the skin. And so by combining those two different types of wounds, you start to see a nice improvement in the skin about 7 days post-treatment when the skin kind of sloughs and flakes off. And then you see another improvement in the skin 30 days later when the skin is rehydrated. You start to see what we always call the halo glow. And then you start to see improvement in, in tightening and pores and collagen, like anything that collagen elastin would be responsible in over 60 to 90 days. So it really is over kind of 3 different segments of time that you get the results from just this one treatment that she's having today. I'm gonna have you tuck your lips in for me. Can't see them perfect. So it's a treatment that you could focus on treating, fine lines around the mouth, any type of acne or any type of scarring really on the body or the face, pores, just overall skin rejuvenation. So that's the first part of the treatment. I'm completely done. So now what I'm going to do is, instead of jumping to the left side of the face, I'm going to go ahead and do a little bit more in the area that she had requested. So I'm going to switch over to the area that I had measured, adjust my settings, and I'm just going to be treating right here at first. So increasing the number of the dots that she sees in the skin also increases what happens in the skin during the downtime, meaning it's going to look a little worse in these areas, but it also will increase the result that she gets. Okay, same thing down here, Hope. Okay, Okay, perfect. So I'll switch to the other side now. How are you doing? Scale of 1 to 10, 10 being the worst, heat or pain you've ever experienced, 5 is moderate.
Yeah, no, I'm fine. I can barely feel anything.
Okay. So she's saying she can barely feel anything. Some people feel more than that. She's pretty tough, but I would say normally what I hear is on a scale of 1 to 10, it's like a 3 or 4. The heat starts to build a little bit. So unlike other treatments that we do, that the skin may feel hot during the treatment and when you leave the heat's gone, I think really the heat is the most intense at the end of the treatment. And it feels like a pretty intense sunburn. Have you tuck your lips in for me? Perfect. And that heat just over the next 2 hours just dissipates slowly. So an hour goes by and half the heat is gone. Another half an hour goes by, 3/4 of the heat is gone. And then it takes right about that 2-hour mark, the heat just shuts off. And we have our clients put on a little bit right here, perfect, a moisturizer, which feels great because the skin starts to feel really tight and dry from the treatment. So it feels nice to be able to put that moisturizer on. Okay. So I'm going to again go back and focus just on a couple of areas where the pores are a little bit larger or she has more of them. And then any area that she had pointed out that may have some scarring from past breakout. Okay. So I also like to mist the skin in between. So I'm going to start on her right cheek just with a cool mist. Hope, here it comes. And you can use that cold air if you need it.
I'm fine.
Are you? Okay. Don't hesitate to use it if you need it.
Yeah.
Okay. And I'm ready to start on her forehead. So right in the middle of her forehead. And so with this device, once you measure the area and dial in your settings, it does all the work for you. All you do is roll the handpiece up and down and back and forth. It's counting all the energy, all the little dots that are delivered to the skin for you. So it knows how to make sure that you're giving a consistent treatment. One of the things that we did at AesthetiCare is we flew in one of the top dermatologists in the country that trains and teaches on Halo to train our team. And this was a few years ago. And we're actually a national training facility as well, but we're always looking to get better and to learn more. And he just does a phenomenal job. And because of that, we're actually the #1 provider of Halo in the country. We do more Halos right here in Kansas City at AesthetiCare than any other clinic. Just being able to tailor the treatment to each one of our clients, to get these beautiful, safe, consistent results. It's one of the reasons why this treatment is so popular. So I'm going to switch to the nose, Hope. And this is just a little bizarre. I'm going to have to kind of move your nose around. The air might go up your nose a little bit. Okay, so I'll just start right in the middle. Right down the right side. And then over to the left. And I'll go up and down the right side of your nose. Kind of pulling on the skin just a little bit to get as close to that lash line or as close to your eye as I can. Same thing over here. Okay. So now I'm going to take a nice look at the skin, make sure that I haven't missed anything, that I have nice consistent redness everywhere. You see all the little white dots sprinkled on the skin. That looks perfect. So I'm going to go ahead and take these off. So she's going to blow some cold air on her skin, and I'm going to mist the skin with just some cool water as well that really helps to cool it down. I'm going to take your eye shields off, and you can keep your eyes closed. I like to finish with a nice cool compress, a nice cool towel. So how was that, Hope?
It was fine.
You doing okay?
Yeah.
Does it feel hotter now than it did before, or has it kind of stayed the same?
It's kind of the same, and I think as time goes on, it'll get a little bit hotter, and then it'll start kind of cooling off. But no, it's fine. This is one of my favorite treatments.
Well, good. I'm glad. Happy you're here doing it. All right, so I'm going to go ahead and put that cool compress on. So it's that simple. I'll finish up the treatment by using the laser sun spray again, the hypochlorous acid, just to help with inflammation and prevent infection. We won't put anything on her skin before she leaves. She'll just jump in her car, and we actually have a great little AesthetiCare fan that you can plug into your phone to cool your skin as you're driving home, or as you're stopped at a stoplight, cool while you're driving home. And then as the heat just dissipates, it'll start to feel better and better. You can use cool compresses when you get home. We also send you home with a mini version of the spring water spray, which is something that I use every day in just my daily routine to help with the cooling and any type of discomfort. So once the heat goes away, she'll put on a moisturizer, and that's all she'll do tonight. She doesn't need to cleanse her skin. She doesn't need to do anything else, just that moisturizer to take away kind of that tight, dry feeling. So we give everything that is needed during that week post-treatment. So Hope will go home with the cleanser that she needs, the moisturizers that she needs, the spray and the fan. So again, everything that you need to take care of your skin post-Halo we'll give to you here at AesthetiCare. If you have any questions, please don't hesitate to call us. Our team is amazing. We are the #1 provider of Halo in the country. So come have a consultation. I promise we'll take great care of you.